Hello, my name is Dave Walrath. I am the legislative advocate for the California Retired Teachers Association. CalRTA represents the interest of the retired educators and beneficiaries of the state teachers retirement system. Today we'll be talking about CalRTA's federal advocacy. CalRTA advocates both at the state level, California, and at the federal level in Washington, D.C. The federal level of advocacy will be primarily on equity. Social Security has penalties on retired California educators. They're called the windfall elimination provision and government pension offset. We oppose those penalties. We want to repeal those penalties. We'll be going back, CalRTA members, we'll be going back to Washington, D.C. on April 26, 2017, to lobby each member of the California legislative delegation on repeal of the windfall elimination provision and government pension offset, opposition to vouchers using public school money for private school purposes, and on assuring that every retiree has access to affordable, quality health care. Those will be our three primary elements of that advocacy in Washington. Members will also be meeting with staff in each of the legislators' district offices in California on the same April 26th day. We are trying to ensure that both at the California district office and at the Washington, D.C. office, the staff and the elected representative both hear the same thing and know our priorities as far as these issues are concerned for our California retired educators. Today's video will be on the healthcare portion. Quite frankly, from CalRTA's point of view, we support retirement security, and there can be no retirement security unless there's healthcare security. Too many people have been forced into bankruptcy because of uncontrolled healthcare costs that they cannot pay. We oppose that. We want, as our goal, access to affordable, quality health care wherever you live in California. To accomplish that, I want to talk about some of our positions and what we'll be talking about when we're in Washington, D.C. Healthcare security. What does it mean? Well, the first part is controlling out-of-pocket and deductible costs for healthcare. And that means ensuring that the cost of healthcare is not ever escalating, that it's not 3 times the consumer price index, that instead it does not increase faster than the expected income increases for retirees. Because if the costs go up and they're not reimbursed, then the out-of-pocket costs of retirees and the insurance deductibles increase. We have to ensure that the whole healthcare system has controlled cost escalation. Controlling premium increases. Medicare Part B and Medicare Part D both have premiums. For many retirees, those premiums can increase significantly because the premium is supposed to pay 1/4 of the health care cost, particularly under Part B. So if health care costs are escalating, then that premium escalates as well. There are some controls, but those controls are not sufficient for all retirees. This is a major issue of, once again, ensuring access to affordable health care, not ever increasing cost of health care for people who are on fixed incomes or very slowly or modestly adjusting incomes. We oppose healthcare rationing, and particularly healthcare rationing that is not seen. The insidious fact of insurance companies deciding they won't pay for particular services. We have to be guaranteed that the healthcare insurance market does not pick and choose the healthcare services based upon who's richest and who's able to afford to pay the most. That is a market rationing in healthcare is too important for a marketplace rationing. We believe that it is wrong to allow insurance companies to charge people between the age of 60 and 65 5 times as much for insurance as is charged to younger people. That is discrimination and age discrimination. We agree that yes, there could be slightly higher costs for those who are above age 60. But 5 times? There's been no documentation that that's an adequate or appropriate recognition of potential differences in cost. But do you trust insurance companies, if they have the ability to charge 5 times, to say, oh no, we won't charge that. We'll only charge maybe 10% more. Insurance companies have stockholders, they have employees, and they have a profit margin. They want to increase their profits. That is the normal world of business. To allow them to gouge seniors is something CalRTA opposes, and will oppose that recommendation that has been made in the American Health Care Act, which we hope will be modified significantly to eliminate that particular provision. We strongly support negotiating prescription drug costs for Medicare, and we're pleased that the President has stated his support for that as well. We believe in bipartisanship. We will support the proposals of both parties when they address the needs of California's retired educators. We appreciate the President's comments on negotiating prescription drug costs because that is necessary to control the ever-escalating cost of health care. For more information on the federal advocacy that we are doing, please go to the CalRTA website, which is www.calrta.org. We have there the talking points that we'll be using on our federal lobbying, and we have our platform. We have a very comprehensive platform that includes health care, benefits, and other issues. And we encourage you to go on the website to look at our advocacy positions, the reasons for those advocacy positions, and for our platform. We hope you will join us in advocating for more equity and affordable access to quality health care. Thank you for watching this video today. Please go to our website. Have a great day.